I'm Dr. Elena Vasquez, and I spent 19 years as a psychiatric nurse at Whitmore Behavioral Health Center in Asheville, North Carolina, or at least I was, until I submitted my resignation 8 months ago. You can call me Dr. Vasquez if you want, though most people in the psychiatric ward just called me the evening shift supervisor during my nearly 2 decades. I've seen everything you can imagine in psychiatric care. Patients who believed they were historical figures like Napoleon or Cleopatra, individuals convinced that their thoughts were being broadcast on national television, people who claimed they could communicate with deceased relatives through radio static, and every kind of delusion, hallucination, and complete break from reality the human mind can create. But what I'm about to tell you about is the one case that made me question everything I thought I knew about the nature of time, reality, and human consciousness itself, and ultimately led me to leave the profession entirely. The woman I'm going to tell you about could draw the future, not symbols or vague impressions, but detailed, accurate depictions of events that hadn't happened yet, events that would occur exactly as she drew them, down to the smallest detail. Events that would kill people if the right information didn't reach the right person at exactly the right time, and I was the person who had to decide whether to believe something impossible or watch innocent people die. Whitmore Behavioral Health Center sits nestled in the Blue Ridge Mountains of western North Carolina, serving a region that spans 3 states, North Carolina, eastern Tennessee, and parts of South Carolina. It's a sprawling 300-bed facility that handles everything from acute psychiatric emergencies brought in by police to long-term residential care for patients with severe and persistent mental illness. The center has earned a reputation throughout the Southeast for taking the most challenging cases, patients who haven't responded to treatment elsewhere, individuals whose conditions are so complex that they require specialized, round-the-clock care from teams of psychiatrists, psychologists, and specialized nursing staff. The facility is divided into 6 distinct units, each designed to handle different types of psychiatric conditions. There's the acute care unit for patients experiencing psychotic breaks or severe mood episodes, the adolescent unit for teenagers with eating disorders and behavioral problems, the geriatric unit for elderly patients with dementia and late-onset psychiatric conditions, the addiction recovery unit for dual diagnosis patients struggling with both mental illness and substance abuse, the maximum security unit for patients with violent tendencies or criminal backgrounds, and the research unit where experimental treatments are conducted under strict protocols. During my 19 years at Whitmore, I worked my way up from a floor nurse fresh out of graduate school to the evening shift supervisor, overseeing a team of 12 nurses, 8 orderlies, and 6 mental health technicians across 4 different units. I specialized in what we professionally call treatment resistance patients, individuals whose symptoms didn't respond to conventional medications or established therapeutic approaches. These were often people experiencing severe psychotic episodes that lasted for months, complex trauma responses that manifested in unusual ways, or rare psychiatric conditions that challenged even our most experienced psychiatrists and researchers. Working with this population requires you to develop a very specific skill set. You learn to listen to elaborate delusions with genuine compassion while maintaining strict clinical objectivity. You become expert at recognizing the subtle differences between organized and disorganized thinking patterns, between visual and auditory hallucinations, between genuine emotional distress and sophisticated manipulative behavior designed to avoid treatment or responsibility. Most importantly, you learn to separate the person from their illness, to see the frightened, confused, or suffering human being trapped inside symptoms they can't control or understand. Over my nearly 2 decades at Whitmore, I consulted on literally thousands of cases. I've worked extensively with patients who believed they were receiving direct communications from religious figures, individuals convinced that government agents were monitoring their every movement through hidden cameras and microphones, people who claimed they could read the thoughts of everyone around them or travel through time in their dreams. I've seen patients create elaborate artwork depicting their internal psychological experiences, dark, chaotic drawings that reflected severe depression or trauma, beautiful but disturbing paintings that emerged during manic episodes, or intricate geometric patterns that seemed to represent their attempts to make sense of disorganized thinking. In psychiatric care, we're trained from day one to approach all patient reports with what we call therapeutic skepticism. We listen carefully, we validate the patient's emotional experience and acknowledge their distress, but we don't accept their altered perceptions as objective reality. When someone tells you they can predict future events, or that they're receiving prophetic visions of things that haven't happened yet, you document it as a symptom of their underlying psychiatric condition, not as evidence of supernatural or paranormal abilities. This approach had served me well for nearly 20 years. I was known throughout the facility for my professional demeanor, my ability to remain calm and rational even during the most chaotic situations, and my skill at helping other staff members maintain appropriate boundaries with patients whose stories could be incredibly convincing. I believed firmly that the human mind, when disrupted by chemical imbalances or psychological trauma, could create incredibly vivid and convincing but ultimately false experiences. I had seen no credible evidence that mental illness could grant someone actual supernatural abilities, only the unshakable conviction that such abilities existed. That was my philosophical and professional foundation for nearly 2 decades. Scientific rationality, evidence-based medicine, and therapeutic skepticism, until October 12, 2023. When everything I thought I knew about the boundaries between mental illness and impossible reality was completely and irreversibly shattered. The case that would change my life forever began on a cold Thursday evening when a 24-year-old woman was brought to our emergency intake unit by 3 officers from the Asheville Police Department. Her name was Sophia Blackwood, and according to the incident report, she had been found in Pritchard Park in downtown Asheville at approximately 9:30 p.m., sitting cross-legged on the cold ground with dozens of detailed pencil drawings spread in a perfect circle around her, like some kind of artistic ritual. According to Officer Martinez's report, Sophia had been talking to herself when they first observed her from across the park. Not the confused, disorganized rambling we typically see in acute psychotic episodes, but clear, coherent sentences that she seemed to be directing specifically at her artwork. Multiple witnesses reported that she was saying things like, "This one happens Tuesday at 3:17 in the afternoon, and the woman in the blue coat needs to see this before Monday morning. And if Dr. Peterson doesn't change the medication, she's going to die Sunday morning at 6:43. When the officers finally approached her, Sophia didn't resist or become agitated like many patients experiencing psychotic episodes. Instead, she carefully and methodically gathered her drawings into a neat stack, looked directly at Officer Martinez, and said something that immediately caught everyone's attention. "I've been waiting for you. Dr. Vasquez at Whitmore is going to want to see these. She's the only one who will understand what they mean." This detail immediately jumped out at me when I read the intake report later that evening. Sophia Blackwood had no previous contact with our facility, no prior psychiatric history that we could locate in our regional database, and no apparent way of knowing my name or that I would be assigned to her case. Our evening shift assignments weren't determined until 7 p.m. each day, and Sophia had been in police custody since before 10 p.m. Yet according to 3 different officers who witnessed the interaction, she had specifically mentioned me by name, and seemed to expect that I would be involved in her care. The police had initially attempted to locate Sophia's family or emergency contacts, but she had no identification of any kind, no driver's license, no credit cards, no cell phone, no documentation whatsoever. She claimed to have no permanent address and gave conflicting information about her background when questioned. Most unusually, she seemed completely unconcerned about her legal situation and kept insisting that the officers needed to bring her to Whitmore specifically, not to any of the other psychiatric facilities in the region. During the intake process, our emergency staff conducted their standard assessment protocols. Sophia appeared to be experiencing what we initially classified as a first episode psychosis, a sudden onset of psychiatric symptoms in someone with no previous mental health history. This condition typically occurs in young adults between the ages of 18 and 30 and can be triggered by various factors, including psychological stress, substance abuse, head trauma, or an underlying psychiatric condition that emerges during early adulthood. But from the very first moment Sophia arrived at Whitmore, it became clear that her presentation was unlike anything I had encountered in my nearly 2 decades of psychiatric nursing. When I first met her in our secure evaluation room at approximately 11 p.m. that Thursday night, she was sitting calmly at the standard metal table that we use for patient assessments, methodically organizing her drawings into neat, precise stacks based on what appeared to be some kind of internal categorization system. She looked up as I entered the room, and I was immediately struck by her eyes. They were clear, focused, and remarkably intelligent, without any trace of the confusion, fear, or disorientation I typically observe in patients experiencing their first major psychotic episode. "Dr. Vasquez," she said before I could introduce myself or begin my standard greeting. "I know you're going to think I'm experiencing delusions. Your training and experience tell you that what I'm about to show you is medically impossible, but I need you to document everything very carefully and precisely, because people are going to die if the right information doesn't get to the right people at exactly the right times." I pulled up my chair across from her, maintaining the calm, professional demeanor I had developed over years of working with delusional patients. "Hello, Sophia. I'm Dr. Elena Vasquez, and I'll be your primary nurse during your evaluation here at Whitmore. Can you tell me about the drawings you were creating in the park tonight?" Sophia nodded and selected one sheet from her stack with deliberate precision. The drawing showed the interior of what appeared to be a large grocery store, rendered in absolutely incredible detail. I could see individual checkout lines with specific cashiers, particular product displays with recognizable brand names, even individual shoppers drawn with remarkable accuracy and attention to facial features and clothing. In the center of the image, she had depicted a massive steel shelving unit in the process of collapsing, with people running in obvious panic and what appeared to be several individuals trapped beneath the fallen structure and scattered merchandise. "This happens tomorrow, Friday, October 13th, at exactly 2:34 p.m., Sophia said calmly, pointing to small precise numbers written in the corner of the drawing. "At the Harris Teeter grocery store on Tunnel Road, the main steel support beam in aisle 7 has developed a stress fracture that will fail catastrophically during the afternoon shopping rush. 3 people will be seriously injured, a mother shopping with her infant daughter and an elderly man who won't be able to move quickly enough to avoid the falling shelves, but no one will die if the store managers evacuate the building by 2:30 p.m. and call in structural engineers to inspect the beam." I studied the drawing carefully, noting details that seemed impossible for someone who claimed to have never visited Asheville before. The level of architectural accuracy was extraordinary. far beyond what I typically see from patients experiencing psychotic episodes, whose artwork usually reflects their internal psychological state rather than external reality. Sophia had drawn specific faces with individual characteristics, accurate store layout and design elements, even brand names on products that were clearly legible and appeared to match actual inventory you might find in a real grocery store. I made detailed notes about Sophia's presentation, following the structured assessment protocols I had used thousands of times over my career. Her speech patterns were organized and coherent, with no evidence of the loose associations or tangential thinking typically seen in psychotic disorders. Her thought processes appeared logical and goal-directed. She maintained appropriate eye contact and showed no signs of responding to internal stimuli like auditory or visual hallucinations. Her mood appeared somewhat anxious but generally stable, without the extreme emotional lability or inappropriate affect often associated with acute psychiatric episodes. "Sophia," I said carefully, choosing my words to avoid either validating or directly challenging her claims, "have you been to this particular Harris Teeter store before? Are you familiar with the layout or the staff?" "No," she replied without hesitation. "I've never been to Asheville before yesterday afternoon. I drove here from Charlotte because this is where the drawings told me I needed to come. I don't choose what I draw, Dr. Vasquez. The images just appear in my mind, complete and detailed, like watching a high-definition movie of things that haven't happened yet. I have to get them down on paper before they fade, or they consume my thoughts until I can't function at all." I documented her response, noting the organized nature of her thinking despite the grandiose content of her claims. "How long have you been experiencing these visions?" Sophia's expression became thoughtful and somewhat sad. "It started approximately 6 months ago, right after my 24th birthday in April. I was working as a freelance graphic designer in Charlotte, living a completely normal life in a small apartment, paying my bills, dating occasionally, talking to my family every week. Then one morning in late April, I woke up with this incredibly vivid and disturbing image burned into my mind: a serious car accident at a specific intersection involving a red Honda sedan and a white delivery truck. The image was so clear and detailed that I couldn't concentrate on anything else. I drew it because I thought getting it out of my head onto paper might help me focus on other things." She pulled out another drawing from her stack, this one showing what appeared to be a busy intersection with vehicles positioned in the exact moment of impact. The level of detail was again remarkable: license plate numbers, the specific positioning of traffic lights, even the expressions on the faces of drivers and pedestrians. The next day, I was driving to a client meeting and happened to pass through that exact intersection. At precisely 2:17 p.m., I watched the exact accident happen: the same red Honda, the same white delivery truck, the same positions, the same sequence of events, exactly as I had drawn it. 3 people were injured, but no one died, and I convinced myself it was just an incredible coincidence. She paused, looking directly at me with an expression that seemed to plead for understanding. But then it happened again, 3 days later, and then again, the following week. Always the same pattern: a vivid image would appear in my mind. I would feel compelled to draw it in exact detail, and then the event would occur precisely as I had depicted it. I continued my standard psychiatric evaluation, asking about drug use, alcohol consumption, recent trauma, family history of mental illness, and any significant life stresses. Sophia's answers were consistently rational and organized. She denied any substance use and agreed to blood tests that would later confirm her claims. She reported no history of psychiatric illness in her family and no recent traumatic experiences beyond the stress of discovering what she believed were her prophetic abilities. "But my family thinks I've had a complete psychological breakdown," she continued. I lost my job because I kept trying to warn people about things I had drawn: car accidents, house fires, workplace injuries. My clients thought I was stalking them or conducting some kind of elaborate, practical joke. I've been living in my car for the past month, driving from city to city, trying to figure out what I'm supposed to do with this ability that no one believes exists. Dr. Patricia Morgan, our senior staff psychiatrist, joined me for a secondary evaluation at approximately midnight. Dr. Morgan had over 25 years of experience in psychiatric medicine and was particularly skilled at differential diagnosis in complex cases. After conducting her own comprehensive assessment, including cognitive testing and a detailed mental status examination, Dr. Morgan's preliminary diagnosis was other specified schizophrenia spectrum and psychotic disorder, essentially a psychotic condition that didn't fit neatly into standard diagnostic categories, but appeared to involve fixed false beliefs about having special abilities. Dr. Morgan prescribed a low dose of risperidone, an antipsychotic medication, and recommended that Sophia be held for mandatory 72-hour observation to monitor her response to treatment and assess any potential safety risks to herself or others. This was standard protocol for patients presenting with their first apparent psychotic episode. But as I prepared to conclude the intake process and arrange for Sophia's admission to our acute care unit, she showed me something that would begin to crack the foundation of everything I thought I knew about the nature of reality. Sophia reached into her stack of drawings and pulled out another sheet, this one showing what appeared to be a hospital room, rendered in startling detail. The image depicted a pediatric intensive care unit with a young child connected to various medical monitoring equipment. Around the bed were what appeared to be family members, two adults who were clearly the parents, and in the corner of the room, she had drawn a doctor in a white coat speaking with the adults in what was obviously a serious, concerning conversation. "This is little Emma Hartwell," Sophia said, pointing to the child in the hospital bed. "She's 8 years old, and she's currently a patient in the pediatric ICU at Mission Hospital here in Asheville. Her parents, David and Jennifer Hartwell, think she's responding well to treatment for pneumonia that she developed after a routine surgery. What they don't know, and what her medical team hasn't yet recognized, is that Emma is going to have a severe allergic reaction to the antibiotic they're currently administering. It happened Sunday morning at exactly 6:43 a.m. I looked at the drawing more closely, noting details that seemed impossible for someone to know without direct access to the hospital. The room layout appeared accurate. The medical equipment was drawn with technical precision, and the faces of the family members were rendered with individual characteristics that suggested real people rather than generic figures. "Sophia," I said, trying to maintain my clinical objectivity while feeling increasingly unsettled, "how could you possibly know about a specific patient at another hospital? Patient information is confidential and protected by federal privacy laws." "I don't know how I know these things," she replied, her voice carrying a note of genuine distress. "I see them in my mind just like I saw the grocery store collapse and the car accident. The difference is that with Emma, if Dr. Peterson doesn't review her allergy history and change her antibiotic before Sunday morning, she's going to go into an anaphylactic shock. The reaction will be severe enough to cause cardiac arrest. If the pediatric ICU team isn't prepared with emergency allergy protocols immediately available, Emma could die." She pointed to specific details in the drawing, the positioning of the medical equipment, the exact time notation written in small numbers in the corner, even what appeared to be the correct hospital room number written along the edge of the paper. "Dr. Vasquez, I know this sounds impossible. I know it challenges everything you've been trained to believe about mental illness and reality, but I've watched this same pattern play out dozens of times over the past 6 months. I see something terrible in my mind, I draw it in exact detail, and then it happens precisely as I've depicted it. The only times I've been able to change the outcome is when I can get specific information to the right person with enough advance notice to prevent the worst consequences. I spent the remainder of that first night reviewing Sophia's complete collection of drawings. There were dozens of them, each depicting different scenes with the same extraordinary level of detail. Some showed car accidents with specific license plate numbers and intersection locations. Others depicted house fires with exact addresses and timestamps. Several showed workplace accidents with recognizable business names and employee faces. Most disturbing were the drawings that appeared to show events that had already occurred. When I researched some of the details, license plate numbers, addresses, business names, I found local news reports and police records that confirmed several of the incidents had actually happened exactly as Sophia had drawn them on the specific dates and times she had noted. That night, I barely slept. I kept thinking about the grocery store prediction and the impossible level of detail in Sophia's drawings. As a mental health professional, I knew I should dismiss her claims as elaborate delusions supported by coincidental details and possibly some research she had conducted to make her stories more convincing. But something about the specificity of her predictions, combined with the genuine distress she showed about her alleged abilities, kept nagging at me. I found myself facing an ethical dilemma that nothing in my training had prepared me for. If Sophia was experiencing delusions, then indulging her beliefs would be therapeutically counterproductive and potentially harmful to her recovery. But if there was even the slightest possibility that her predictions were accurate, then ignoring them could result in preventable injuries or deaths. By Friday morning, I had made a decision that would fundamentally alter the trajectory of my career and my understanding of what was possible in this world. During my lunch break on Friday, October 13th, I did something that violated every principle of professional skepticism I had maintained throughout my career. I decided to test Sophia's prediction about the grocery store collapse. I called the Harris Teeter store on Tunnel Road and asked to speak with the manager. When David Chen came to the phone, I took a deep breath and said something that made me feel both foolish and desperate. "And Mr. Chen, this is Dr. Elena Vasquez from Whitmore Behavioral Health Center. I know this is going to sound unusual, but I'm calling to report a potential safety hazard in your store. I have received information suggesting that there may be a serious structural issue with the steel shelving unit in aisle 7. I strongly recommend that you have your maintenance team conduct an immediate inspection of the support beams." There was a long pause. "Ma'am, is this some kind of prank call? How would you have information about our store's infrastructure, and what kind of structural issue are you talking about?" I realized how completely ridiculous I sounded, but something compelled me to continue. "Mr. Chen, I understand this seems strange, but I'm a licensed psychiatric nurse calling from a major medical facility. I'm asking you, as a professional courtesy and out of concern for public safety, to please have someone inspect that shelving unit before 2:30 this afternoon. If there's any possibility of a structural failure, it could prevent serious injuries to your customers and staff." "Okay, Dr. Vasquez. Dr. Elena Vasquez. Dr. Vasquez. I'll have our maintenance supervisor take a look at aisle 7 this afternoon. Can you be more specific about what type of structural problem you're concerned about?" I looked at Sophia's drawing, feeling increasingly surreal about the entire conversation. A stress fracture in the main support beam, something that might not be visible during routine visual inspections, but could cause a catastrophic failure when the shelving unit is fully loaded with merchandise and customers are shopping in the area. "I'll have Jake check it out within the hour," Mr. Chen said. "Can I get a direct number where I can reach you if we find anything?" I gave him my extension at the hospital and spent the rest of my shift trying to focus on my other patients while obsessively checking the clock every few minutes. At 2 p.m., I positioned myself at a window where I could see the parking lot, as if somehow I might be able to observe the grocery store situation from 2 miles away. At 2:47 p.m., exactly 13 minutes after Sophia's predicted time, my phone rang. "And Dr. Vasquez, this is David Chen from Harris Teeter. I honestly don't know how you knew about this, but my maintenance supervisor found a hairline stress fracture in the main support beam for the shelving unit in aisle 7. We've immediately evacuated that entire section of the store and called in a structural engineer for an emergency assessment. Jake tells me that if that beam had failed with the normal afternoon customer load and fully stocked shelves, the entire unit would have come down, could have seriously injured or killed several people. I stood there holding the phone, feeling like the floor had literally dropped out from under me. My hands were shaking, and I had to sit down to continue the conversation. Was the fracture visible during your routine maintenance inspections? I managed to ask. That's the really strange thing, Dr. Vasquez. Jake says absolutely not. The crack was hidden behind the mounting bracket, where we never would have found it during normal maintenance checks. The beam would have just failed suddenly, probably within the next few days when the store was busy. Dr. Vasquez, I have to ask, how did you know about this? This could have been a major disaster. I didn't have an answer that would make sense to anyone, including myself. I'm just grateful you found it in time and that no one was hurt, I said. After I hung up, I sat in my office staring at Sophia's drawing for what felt like hours. One impossible prediction that had proven accurate down to the smallest detail. I tried to convince myself it was an incredible coincidence, that somehow Sophia had made an extraordinarily lucky guess, based on some kind of intuitive understanding of structural engineering or retail environments. But deep down, I knew I was grasping for rational explanations that simply didn't fit the facts I had witnessed. That evening I returned to Sophia's room for our scheduled follow-up session, feeling like I was entering completely uncharted territory. She was sitting at her table, working on a new drawing, with the same intense, almost trance-like focus I had observed the night before. When she saw me enter, she looked up with an expression that seemed to combine relief with deep sadness. "You called the grocery store, didn't you?" she said quietly, though it was clearly more of a statement than a question. I felt my heart rate spike dramatically. "How do you know that?" "Because that's what you were supposed to do, Dr. Vasquez. That's exactly why I drew it with such specific detail, why I included the exact time and location. I can't prevent these tragedies from happening directly. I've tried many times, and it never works. But sometimes, if I can get the right information to the right person who has the authority and credibility to act on it, they can change the outcome and save lives." I pulled up my chair, feeling like I was stepping into an entirely different reality than the one I had inhabited for my entire professional career. "Sophia, the maintenance supervisor, found the stress fracture exactly as you had drawn it. The beam would have failed catastrophically, probably causing serious injuries or deaths." She nodded with an expression of profound sadness. 3 people would have been hurt badly, Dr. Vasquez. Maria Santos, a 34-year-old mother shopping with her 6-month-old daughter Isabella, and Robert Chen, a 72-year-old retired teacher who wouldn't have been able to move quickly enough to get out of the way. Now they'll all go home safely to their families tonight, and Maria's daughter will grow up with her mother, and Robert will get to see his granddaughter graduate from high school next year. But how is this possible? How could you know about a structural flaw in a building you've never visited, involving people you've never met? Sophia set down her pencil and looked directly at me with eyes that seemed to carry the weight of terrible knowledge. "Dr. Vasquez, I don't understand it any more than you do. 6 months ago, I was a completely normal person, living a completely normal life. I didn't believe in psychic abilities or supernatural phenomena. I still don't. Actually, I don't think what's happening to me is supernatural. I think it's something we just don't understand yet, about how time and consciousness and reality actually work." She showed me her latest drawing, and I felt a cold chill run down my spine. This one depicted the pediatric ICU at Mission Hospital with the same impossible level of detail and accuracy I had seen in her grocery store prediction. I could see the specific room layout, advanced medical equipment drawn with technical precision, and even what appeared to be the correct color scheme and architectural details of the actual hospital unit. Emma Hartwell is going to have her allergic reaction in approximately 36 hours, Sophia said with quiet certainty. Dr. Peterson needs to change her antibiotic regimen before Sunday morning, and the pediatric ICU team needs to have emergency allergy protocols immediately available. The reaction will be anaphylactic shock, severe enough to cause cardiac arrest if they're not prepared for it. If they don't have the right medications and equipment immediately at hand, Emma could die while her parents watch. I stared at the drawing, feeling the same surreal reality-shifting sensation I had experienced during my phone call with the grocery store manager. Sophia, I can't call a hospital and tell them to change a patient's medication based on a drawing. I know, she said, and I could see tears beginning to form in her eyes. But you can call and suggest that Dr. Peterson review Emma's complete allergy history one more time. You can recommend that they have emergency allergy protocols in place and ready for immediate use on Sunday morning. You don't have to tell them why or how you know, you just have to give them enough information to be prepared. As I sat there looking at Sophia's impossibly detailed and accurate drawings, I realized that I was facing a choice that would define not only my career but my entire understanding of reality itself. I could dismiss her claims, follow standard psychiatric protocols, and potentially watch a child die. Or I could accept something that challenged every rational belief I had ever held about what was possible in this world. But what Sophia showed me next would make that choice even more difficult and more urgent than I could have ever imagined. Sophia reached for another drawing, this one larger and more complex than the others. As she unfolded it, I saw that it depicted our own hospital, Whitmore Behavioral Health Center, but something was terribly wrong with the image. Part of the east wing appeared to be engulfed in flames, with emergency vehicles surrounding the facility and people being evacuated on stretchers and wheelchairs. Dr. Vasquez, this is why I had to come to Asheville. This is why I needed to meet you specifically. What I'm about to show you in this drawing is going to test everything you think you know about what's possible, and it's going to put you in a position where you have to decide whether to trust me completely and risk your career and reputation, or ignore what I'm telling you and watch people you work with every day die in a preventable tragedy. I stared at the drawing, recognizing specific architectural details of our facility, seeing faces of colleagues and patients I knew personally, and feeling a terror I had never experienced in my professional life. When does this happen? I whispered. Sophia pointed to the time notation in the corner of the drawing. Tuesday, October 17th, at 11:47 p.m. An electrical fire starts in the basement of the East Wing and spreads faster than anyone expects because of a malfunction in the fire suppression system. 12 patients are evacuated successfully, but 3 don't make it out in time, and 2 staff members are seriously injured trying to save them. I looked at her with complete bewilderment and growing dread. But we have extensive fire safety systems, backup power, multiple evacuation protocols, trained staff. Dr. Vasquez, Sophia interrupted gently. 2 days ago you thought it was impossible for me to know about a stress fracture in a grocery store I'd never visited. Yesterday you thought it was impossible for me to predict a child's allergic reaction in a hospital I'd never been to. How many impossible things do I have to show you before you're willing to consider that maybe, just maybe, I'm telling you the absolute truth? I called hospital maintenance about the electrical system. They found faulty wiring that could have caused the exact fire Sophia predicted. Tuesday night at 11:47 p.m., repair crews were working in the basement. The fire never started because they disconnected the dangerous wiring hours earlier. Sophia showed me one final drawing herself leaving Whitmore at 8:15 a.m. Wednesday. It happened exactly as depicted. Hospital administration investigated how I knew about electrical problems. I couldn't explain without sounding insane. My credibility was destroyed. I resigned 8 months later. Some mysteries challenge everything we believe about reality. Sophia could draw the future, and I'll never be the same.